Hi everybody, my name is Amber DeJohn. I am a PhD student at the University of Toronto, and today I'm going to be presenting my work, Transit Access to Subsidized Food Stores in the American Midwest. So just a quick introduction, food insecurity is a household-level economic and social condition of limited or uncertain access to adequate food. About 1 in 8 Americans are thought to be food insecure, and that rate is actually higher for marginalized groups like low-income populations and racial and ethnic minorities. The federal government is trying to combat food insecurity through the Supplemental Nutrition Assistance Program, also called SNAP and occasionally called food stamps. For those who aren't familiar, a store must be authorized in order to accept SNAP subsidies. So not every grocery store or every convenience store that you see will accept it. This creates a unique food environment where SNAP participants are kind of having to navigate their food environment based on where they're able to use their SNAP dollars potentially. This is also kind of in concert with the mobility options that are available to an individual. So this leads me into my research questions. The first is, do low-income populations and racial minorities have low levels of transit access to SNAP authorized retailers? I focus on transit access in this study because poor access to transit has been shown to exacerbate financial precarity in the transport poverty literature. Car ownership brings with it many associated costs, including insurance and gasoline, that in many cases is not manageable. So I seek to understand where there are potentially food insecure populations who also suffer from transport poverty, as these populations are kind of being marginalized or excluded from two aspects of their built environment. That leads me into my second question. Are certain types of SNAP authorized retailers like convenience stores more accessible via transit than others like supermarkets for low-income communities and racial minorities? Because there's a spirit of healthy eating to this study, I really do want to know if stores with better assortments of fruit and veg are more accessible or less accessible than convenience stores, which can also be SNAP authorized stores. Not all SNAP stores are created equally, and I do really try to build that into this study because a part of access, beyond just like being able to get there, is having it be appropriate food. So I kind of hope to cover that later on. And then my last question is, do neighborhoods with lower levels of transit access to SNAP retail coincide with those classified as low income, low access to healthy food by the U.S. Department of Agriculture? So this question is kind of going to evaluate how the USDA is currently mapping and showing us where the low access, low income areas are, and hopefully we'll get to kind of compare and see if transit access is kind of mirrored or reflected in those measures. My study area is the American Midwest, as I've said. I focus on 33 metropolitan planning organizations called MPOs across 6 states. And I use metropolitan planning organizations because these organizations actually are supposed to be building metrics around how people access essential services, of which food is one. So I found them to be a very natural unit of examination. And that also helps me to build in kind of these gray areas between metropolitan centers that a lot of transit networks actually cover. So my first step in my methods was calculating the transit travel times. I used OpenTrip Planner to build network graphs for transit routing. This is why I had to exclude some of the MPOs in the Midwest. There are much more than 33, but only 33 of them had available GTFS data. So I had to exclude the other ones so that I could build my network graph. I then routed from origins, which were block group centroids, to destinations, which were SNAP stores. As a note, the SNAP stores were provided to me by Dr. Shannon, so thank you, Dr. Shannon. So I calculated the transit travel time for every minute in a 1-hour window. That 1-hour window surrounded a peak time reported on the National Household Travel Survey for when people reported running their errands. So the observation window was 9:30 to 10:30. I also did a couple other hours throughout the day when there were like local maxima in reports of running errands, but I didn't really find any temporal variation. There was some, but not enough to include here. After calculating my transit travel times, I built 3 accessibility variables that were calculated from those outputs. The first was a composite access score called AI, and it's the sum for the closest 5 stores to an origin. of the impedance function and a weight. The impedance function was calibrated using the National Household Travel Survey information for median trip time for errands, and then I used a weight to kind of reflect the quality of the store. So stores like convenience stores had a lower weight, and like a store like, for instance, Walmart would get a high weight, because I would imagine that Walmart has more variety than a convenience store. I also built two smaller scores that were specific to the type of store. So CI was the score for small retail, and SI was the score for a supermarket. And that was very simple. It was just the impedance function for the closest of either type for a centroid. So getting into my results, for the first question, I did find that some individuals were living in low transit access neighborhoods. About 282,000 Hispanic and Black individuals were living in these places, and about 108,000 low-income people were also living there. Additionally, about 24,000 people who reported receiving public assistance were living in these areas. This is just a map of the composite transit scores in one of the MPOs, which is the Metropolitan Council. So this is where Minneapolis and St. Paul are. As you can see, the transit scores are higher, which is better, in the downtown core area. And as you move away from that downtown core, the scores generally go down until you reach areas of low transit access, or the gray areas, which are no transit access. For my third question, I found that convenience stores are much more accessible overall, which was somewhat expected. But for some marginalized groups, there's actually a large difference between access to supermarkets and access to convenience stores. This table just illustrates the numbers of people in each group who have low transit access to small retail and supermarkets. And I do want to draw your attention to the Black population, as almost twice as many people have low access to supermarkets than small retail in the Black population. And when you look at the other groups included in the study, this trend just doesn't really extend to them. So that is cause for concern. So this is just a map showing the differences between the small retail access and the supermarket access. I don't know that this is entirely surprising, as convenience stores are lower order retail, so there are more of them, and they're usually, as the name implies, they're more convenient, so it makes sense that more people have access to them. Lastly, I looked at low-income, low-transit access neighborhoods vis-a-vis the USDA LILA tracks, and what I ultimately found was that in most cases they're the same, but about a third of low-income, low-transit access neighborhoods that I identified were not included in the USDA's LILA neighborhoods. And you can see that here, where a lot of the LILA neighborhoods in downtown Flint are not coinciding with Lilton neighborhoods, and there are some Lilton neighborhoods up in the upper left-hand corner that are not being caught by LILA. So moving into kind of closing thoughts here, some takeaways from my study is that neighborhoods with lower transit access to SNAP were largely peripheral, low density, majority white, and affluent neighborhoods. But I did show that there are thousands of individuals living in these neighborhoods, and this is somewhat reflective of the study design that I used, wherein I identified low transit access neighborhoods and then quantified the amount of people living in those neighborhoods. And what this kind of reveals, especially when you look at the LILA-LILTA comparison, is that while the USDA's LILA tracks do largely reflect areas of low access using their methodology, when you're looking specifically at low transit access, I was able to identify areas where there are potentially food insecure people who are not being serviced by the transit infrastructure and might be suffering from additional low access because they can't access SNAP. So in looking at policy responses, I think that this needs to be a local focus for policymakers, not so much something that we can do with broad strokes. That said, I don't think that additional fixed route transit makes sense, given that a lot of these areas are in fact low density and they're largely affluent, so I don't think we would see a lot of transit patronage there. But initiatives like the USDA's online SNAP pilot that's currently happening in New York State might be an effective way to reach these populations that are currently not being picked up in the Lila tracks but are potentially food insecure and suffering additionally from transport poverty. So I just want to say thank you for listening, and I really look forward to hearing all of your questions.